since we're on dose, and I know we're kind of bouncing here, but more is not always better. And it drives me nuts when I, go online or I hear other people talking. It's like, you have to blast it as much as you possibly can. And sometimes that's not always a good thing. Can you talk about the benefits of milligram dosing versus gram dosing and age, their current health condition? You've worked with patients that have been elderly and they take a high dose, say a gram of oil, which is a very uncomfortable feeling. And I always describe it like, and I've never taken a gram. I took a capsule one time of Corinne's father when Corinne and I were down in Santa Barbara, and we had to pick up some medicine for him. And our normal dispensary was up here in the San Francisco Bay Area. And we ended up getting a capsule, and it turned out it was a quarter, or it was a half gram of oil. And that I shook for 2 days. So it's an uncomfortable feeling. It's not something you can.
How could that dose of a natural plant that makes people violently ill be the right dose? I mean, we have to use logic to some extent. That's ridiculous. And also, to me, why not use since every major cannabinoid and even the major terpenes, every one has been shown to be anti-cancer. Every one has been shown to help with pain and other issues. I can't think of any reason not to use it, whether you believe it's just going to be helping you feel better and sleep better and tolerate chemo, and as well as preventing side effects and preventing long-term effects like neuropathy. Also, there's just an article out that CBD, there's a chemo drug, doxorubicin, and there's a number of drugs related to it that really knock out your heart. And CBD prevents that heart damage from the rubicins. These are big deals. They're really big deals. And while it's helping the chemo work, I think the chemo helps the cannabis work. And I'm not anti-chemo. It depends what it comes down to at the end of the day. From my suggestion with people is, well, one, their history and how they've been doing and tolerating stuff. But I think that if there's a 30 or 40% chance that you can get that data that you're going to have a good response, that's worth it. Maybe 40%. But if they give you 10%, that means it doesn't work. And then you're doing it just so that you're doing something. And I would say just do the cannabis.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatientsGroup and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.